It might be challenging to determine what your skin actually needs to be as healthy as possible. Every day, we are bombarded with advertisements for a wide range of skincare and cosmetic products, as well as tips from social media influencers and other experts in the field of beauty. So what does the research say your skin actually needs? What aids in the pursuit of clear, bright skin? Let's dive in. If you have oily skin or are prone to breakouts, don't skimp on washing your face as part of your morning and evening skincare routine. A study was conducted that focused specifically on the frequency of face washing. The participants were asked to wash their faces 1, 2, or 4 times each day for 6 weeks. The acne lesions of individuals who cleansed their faces twice or more a day improved significantly by the conclusion of the research. The individuals who simply cleansed their faces once a day had the greatest increase in acne. When it comes to selecting the best cleanser, fancier isn't always better. A comprehensive summary of 14 studies discovered that the type of cleanser you use makes little difference in acne outbreaks. The tests comprised everything from cleansing bars and antimicrobial soaps to alpha and beta hydroxy acid cleansers. While this may be disheartening, if you've spent a lot of money on a high-priced cleanser, the conclusion here is that keeping it simple is usually better. A gentle cleanser with few ingredients and smells can perform just as well as more expensive solutions. What role does a moisturizer have in keeping your face clear? If your skin is very dry, it may attempt to compensate by producing extra oil. The end result? Breakouts. Moisturizers, like cleansers, do not have to be pricey or include exotic ingredients. More significantly, search for a non-comedogenic moisturizer. This means that it will not clog your pores. If you have oily skin, lightweight moisturizers may be ideal to avoid a heavy, greasy feeling. During the winter, cold, dry air can cause the skin to feel tight and dry out, so some people switch to heavier moisturizers. Inadequate sleep may also cause your skin to break out more frequently. According to a 2015 survey, more than 65% of those who stated they were exhausted also had acne. The study's authors hypothesized that a lack of sleep could lead the body to release inflammatory substances in some instances. These substances may induce acne or worsen existing acne. Aim for 7 to 9 hours of great sleep each night to be healthy on the inside and out. Water is required by all cells in the body. Because skin cells are the closest to the environment, they may be more vulnerable to moisture loss. Drinking water throughout the day will improve the health of skin cells. Eating a nutritious diet is beneficial to the body as a whole, and it could also improve the skin. A diet high in plant-based foods and lean protein sources may help provide the nutrients the skin requires to stay healthy. People who want to keep their skin clear may also want to avoid some troublesome foods, such as dairy milk. A study published in Clinical Nutrition discovered a link between milk and acne. Some believe that this connection is due to the growth chemicals and hormones found in milk. However, each person may have various trigger foods that aggravate their symptoms. It's quite difficult not to pick at a zit. However, it is critical to resist for the sake of your skin's health. Picking or popping a zit exposes the pore to additional bacteria, including bacteria from your fingertips. It also raises the possibility of infection or scarring. Consult a dermatologist if you have a painful pimple. They can use specialized treatments to safely remove the pimple while reducing the danger of infection. It is also critical to reduce stress wherever feasible. Acne vulgaris is one of the most frequent inflammatory skin conditions, according to the authors of a 2017 paper. They further emphasize the connection between stress and acne. claiming that stress can cause an increase in inflammatory substances in the body. Anger or emotional stress can cause acne breakouts or worsen existing problems. As a result, it is critical to find techniques to reduce stress to treat acne. There is substantial scientific evidence linking smoking to an increased risk of acne. Acne-prone women aged 25 to 50 were included in one study. The authors of this study discovered that over 73% of the participants who smoked had acne, while only 29.4% of the women who did not smoke had pimples or other forms of acne. If you need assistance quitting smoking, consult your doctor about possible quit aids. Exfoliation can aid in the removal of dead skin cells. If these cells remain on your skin for an extended period of time, they can block your pores and cause breakouts. A collection of dead cells on your face can also make it appear dull, flaky, or prematurely aged. The frequency of exfoliation is determined by the type of exfoliation used. Chemical exfoliants, such as masks or lotions, should be used once or twice a week. Use physical exfoliants, such as scrubs or brushes, 3 or 4 times per week. To avoid over-exfoliation, start with fewer exfoliating sessions and work your way up. If you have inflammatory acne, pustules, and cysts, the AID recommends that you talk to your dermatologist first, as some types of exfoliation may make inflammatory acne worse.